The shocking news came from the South Korean entertainment world. Jungkook, a member of the BTS group known for his talent and popularity, is reportedly experiencing an alarming health condition. According to reports, he vomited up to 12 times in a short period of time, allegedly as a result of poisoning. This incident made fans around the world anxious and hoped that Jungkook would recover soon. Chronology of events. This incident was first made known when Jungkook reportedly did not attend a certain schedule that had been announced earlier. His agency later released a statement that Jungkook had a health condition that required medical treatment. A nearby source said that he began to feel unwell after eating certain foods, which subsequently led to vomiting. According to medical reports, Jungkook vomited up to 12 times and experienced symptoms such as dizziness, weakness, and clear discharge when vomiting. This led to the suspicion that he had food poisoning. This condition is of course a serious concern because repeated vomiting can lead to dehydration and other health complications. Explanation of the doctor. A doctor who dealt with this case explained that vomiting up to 12 times in a short time is not something that can be underestimated. If a person experiences repeated vomiting, their body loses a lot of fluids and electrolytes, which can lead to severe dehydration. In some cases, the clear liquid that comes out indicates that the stomach is empty, but the gag reflex persists, he explains. The doctor also mentioned that food poisoning can occur due to the consumption of food contaminated with bacteria, viruses, or harmful chemicals. Symptoms include nausea, vomiting, diarrhea, abdominal pain, and in more serious cases, fever or fainting. Handling steps. After repeated vomiting, Jungkook reportedly immediately received intensive medical care. Doctors give him intravenous fluids, infusions, to replace lost body fluids. In addition, he is given antiemetic drugs to stop the gag reflex. The rest of the treatment involves complete rest and a special diet to restore the functioning of the gastrointestinal tract. The food given is usually light and easy to digest, such as porridge, white bread, or clear soup. Fan reaction. The news of Jungkook's condition left fans known as ARMY feeling anxious. Hashtags like #GetWellSoonJungkook and #StayStrongJK soon became trending on social media. Many fans sent prayers, messages of support, and wishes for Jungkook's speedy recovery. Some fans also called for the importance of health above all else, given the busy schedules that BTS members often live. They hope the agency provides enough rest time for Jungkook to fully recuperate. The importance of maintaining food hygiene. This case is an important reminder for everyone to always pay attention to the hygiene of the food consumed. Here are some preventive measures to avoid food poisoning. Hand washing. Always wash your hands before eating or processing food. Pay attention to the cleanliness of groceries. Make sure the groceries are fresh and washed thoroughly before cooking. Cook until cooked. Make sure food, especially meat, is cooked until cooked to kill bacteria. Store properly. Store food at a suitable temperature to prevent bacterial growth. Avoid expired foods. Check expiration dates before consuming food products. Hope and recovery. Although this condition is alarming, recent reports say that Jungkook's condition is starting to show signs of improvement. With proper medical care and support from those closest to him, Jungkook is expected to recover soon and return to his usual activities. For fans, the health of their idols is certainly a top priority. This case is also a reminder for all of us to always maintain health and pay attention to hygiene, especially when it comes to food. Hopefully Jungkook recovers soon and can again entertain fans around the world with his incredible spirit and energy. Jungkook's case highlights the importance of understanding food poisoning. Although often considered a mild problem, food poisoning can have serious consequences, especially if not treated properly. Here are some important facts. Symptoms of food poisoning. Food poisoning usually causes varied symptoms depending on the type of contaminant that is the cause. Some common symptoms include nausea and vomiting. These symptoms occur because the body tries to remove toxic substances from the digestive tract. Diarrhea, due to irritation of the intestine by bacteria or viruses. Fever, a sign that the body is fighting an infection. Abdominal pain and cramps. They usually occur due to excessive contraction of the intestinal muscles. Weakness and dizziness, caused by a significant loss of fluids and electrolytes. In Jungkook's case, repeated vomiting up to 12 times showed that his body reacted violently to the toxic substances that it entered. This is an indication that the contaminants entering his body are strong enough to trigger an extreme reaction. Common causes and types of contamination. Food poisoning can be caused by various factors, among which bacteria. Salmonella, E. coli, and Campylobacter are the main causative bacteria. Viruses. Noroviruses often cause outbreaks of food poisoning in public places. Parasites. Some parasites, such as Giardia, can contaminate food or water. Natural toxins. Some seafood or certain mushrooms contain harmful natural toxins. Chemical contamination includes pesticides, heavy metals, or other chemicals that contaminate food. The cause of Jungkook's poisoning is confirmed. It could be an important lesson in preventing similar incidents in the future. Medical protocols in dealing with food poisoning. When someone has severe food poisoning like Jungkook's, medical treatment becomes very important. Here are the general protocols carried out by medical personnel. Early diagnosis. The doctor will usually ask for a history of food consumed by the patient to identify the source of contamination. Tests of blood, urine, or stool samples may also be performed to detect the presence of bacteria, viruses, or toxins. Rehydration. Fluid loss due to vomiting and diarrhea should be replaced immediately. Intravenous fluids, infusions, are often used to speed up rehydration and restore electrolyte balance. Drug administration. Antiemetics. These drugs are given to control nausea and vomiting. Antidiarrheal. If needed, this medicine helps reduce the frequency of diarrhea. Antibiotics. Only used if poisoning is caused by a specific bacterial infection. Antitoxin. In the case of food poisoning from toxins, an antitoxin can be administered. Close monitoring. Patients like Jungkook, who are experiencing severe symptoms, will be closely monitored to ensure there are no complications such as kidney failure due to severe dehydration. The role of agencies in maintaining the health of artists. The health of K-pop artists is often in the spotlight due to their hectic schedules. In Jungkook's case, BTS's agency, Big Hit Music, has shown responsibility by making sure he gets medical treatment immediately and providing fans with updates. However, this also raises the question of the need for a better system to protect the health of artists. Fans hope the agency can provide enough rest time for the idols, given the physical and mental stress they face. Some agencies in the K-pop industry have taken proactive steps, such as providing specialized medical teams and mental health counseling. Cases like these continue to emerge. A more comprehensive approach may be needed to ensure artists remain healthy and safe. On the other hand, some enthusiasts are also taking advantage of this moment to raise awareness about the importance of food safety. They shared tips on how to choose safe food, including checking the cleanliness of restaurants and cooking their own meals if possible. Post-poisoning recovery measures. Once his condition stabilizes, Jungkook may need several days to weeks to fully recover. Here are some recovery steps that are usually recommended. Light diet. Food poisoning patients are advised to avoid heavy and oily foods during the recovery period. Food options such as porridge, white bread, bananas, and clear soup are best. Avoid dehydration. In addition to water, electrolyte fluids such as ORS or diluted fruit juices can help maintain body fluid balance. Monitor the condition of the body. Symptoms such as dizziness, weakness, or vomiting that reappear should be reported to a doctor immediately. Rest enough. Optimal recovery requires adequate rest periods so that the body can recover energy. Message to fans and community. This case is a reminder for all of us to be more concerned about the cleanliness of food consumed. While we can't completely control the quality of food outside the home, there are simple steps we can take, such as choosing a trusted place to eat and making sure food is cooked properly. For Jungkook's fans, this moment is an opportunity to show support in a positive way, such as continuing to send prayers and remind them of the importance of health, both for the idol and for themselves. Conclusion. The incident that happened to Jungkook is a warning to everyone about the importance of maintaining health, especially when it comes to food. With proper medical treatment, Jungkook is expected to recover soon and return to greet fans with his trademark smile and energy. Let us pray that he recovers soon and is always in good health.